Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about Iodosorb. But first, if you could hit a like and subscribe, it would be greatly appreciated as it does help my channel grow. So Iodosorb is a broad spectrum iodine-based topical paste, which is an antimicrobial. So it does contain the 0.9% iodine, and it has modified like a starch microbead, so that absorbs any debris or bacteria as the beads swell and the iodine is released, providing the antimicrobial activities for up to 72 hours. And this also does disrupt and eradicate mature biofilms. It's available in a paste, powder, or ointment. And all forms are brown in color and biodegradable. And they do change color as the iodine is released into the wound. So it does go from a brown to a yellowy gray color. And this product is also safe for clients who have a seafood allergy. We're going to use the Iodosorb for topical treatment of chronic exudating wounds, for sloughy wounds with signs and symptoms of a local infection. Now, if it is a deep spreading infection, you can also use it, but they do need an antibiotic. Or you can use this for suspected biofilms because it is a debrider, so it will get that biofilm up. So you're going to use the ointment or paste for small to moderate exudating wounds, and the powder is for moderate to large exudating wounds. So that's the amount of drainage coming out of the wound. So small to moderate, you're using your ointment and your paste, and you're going to use your powder for large amounts of discharge. You can use this prophylactically to prevent infection in clients at high risk for developing a wound infection. So just in spots that patients are at high risk for infection, you can use this prophylactically. I personally, if a patient doesn't have an infection, you want to stay away from the antimicrobials and only use them when they actually have an infection. So you're using your NERDs and stonies to determine if they have an infection and whether it is a local infection or a deep spreading infection. The ointment may be used for undermining sinus and tunnels, and it can be used under compression therapy. Precautions for Iodosorb. Make sure that you're not using more than 50 grams of the paste or whichever form you're using. Don't use more than 50 milligrams per dressing change, and you can only use a maximum of 150 grams per week. The duration of treatment should not exceed 3 months. When you apply the Iodosorb, it can cause discomfort for the first hour of application. This is just a sign that it is cleaning the wound, but make sure that your patient is aware of this, because you might leave the room, or if you're in the community, it might start stinging after you leave, and they start getting worried that they need to remove this. So just make sure that they are aware. It can cause discomfort for the first few hours. If it's exceeding that, the wound does need to be looked at, because it might just be causing skin irritation. If this product comes in contact with the wound edges or intact skin, it can cause the tissue to become red or swollen. Now, this should resolve within the first few dressing change, but if it doesn't, make sure that you're discontinuing use, because it just could be an irritant to the patient. You're not going to use this before or after radioiodine diagnostic tests. And you're going to make the physician or nurse practitioner aware of the Iodosorb being used for the client, especially those that are taking lithium, have renal impairment, thyroid disorders, and thyroid function should be monitored if large areas are being treated for prolonged period of time, just because the iodine can cause thyroid function issues. Contraindications. So we're not going to use this on clients who have an allergy to iodine or any of the other ingredients that are on the label. Don't use this on dry or necrotic tissue. We're not going to use this for breastfeeding or pregnant women or children under 18 years of age. We also should not be using this with other antimicrobials or antiseptics. And we're not going to use this around the ears, eyes, nose, or mouth. So to apply, first we're going to clean the peri-wound and wound itself with some normal saline, and then you're just going to dry the peri-wound. Make sure that you leave the wound bed moist because it does need some moisture there. And if you need to, apply a barrier film onto the peri-wound skin. So for the ointment, we're going to apply a 3 millimeter thick layer over the wound, and just make sure it's in the wound bed, not on the peri-wound, and then you would apply the cover dressing. Now, you can put the ointment on the cover dressing itself. Just make sure that you're mirroring the wound because you don't want it onto the peri-wound tissue. For packing a wound, you're just going to use either a tongue depressor or a sterile glove to spread and massage the ointment into a piece of plain ribbon gauze that's used for packing, and just lightly pack the area with the gauze, leaving a tail. So it should normally, I leave a good sized tail just so that it can easily be removed or found by another nurse who is replacing it. So for the paste, this comes in the little, it's just like a square, and it has two sides on it. So you're going to cut the piece just to put into the wound, and it can be molded into the wound to fit properly for those irregular shapes. And then you're just going to remove the back siding. So it can go either way because it's the same thing on either side. You just have to remove one side to put it on, and then you remove the other side. And for the powder, you're just going to cut the corner of the little sacket and just put a 3 millimeter thick of powder. And if the wound's deeper than that, you can use a wound filler of whatever sort, just a plain wound filler, gauze, and then your cover dressing over top of that. So to remove this, you want to make sure all the ointment remnants are gone, whether it's the ointment, the paste, the powder. You want to make sure to get that all out of there. You don't want any residue left behind. So you might need to use a cotton tip applicator to remove it. Normally it's pretty moist on there, but if it does dry, just add some normal saline to it and it should wipe away quite easily. But you do want to make sure that it is completely removed before reapplying. If it's packing, just make sure that you're removing the packing and then just repeating cleansing until there's no residue left behind. So the frequency of dressing change, it is a maximum of 3 days depending on the amount of exudate. So when the color indicator says like it goes from the brown to the yellowy gray color, normally 2 to 3 days, you want to change it. So if it's changing color within 1 day, it needs to be changed daily. The expected outcome of using this is that local signs of infection are gone within 2 weeks, sloughy material, all that is gone. And I do just have the different formatting sizes right here that you can see. So that is all I have for this video. I hope to see you in my next one.